Hello, guys. For my pathology 150 disease, I got Graves' disease. All right, so what is Graves' disease? Graves' disease is known as an autoimmune disorder that causes hyperthyroidism due to an excessive production of thyroid hormones. So, this disease is more common in women than men between the ages of 30 to 60 years old, and it is a lifelong chronic condition. Here, we're going to be taking a look at the anatomy of the thyroid gland. The thyroid has two lobes. Thyroid gland is located in front of the neck and just below the Adam's apple, as we see here. And it sits in the level of the C5 to T1 vertebrae. And a unique thing about this thyroid gland is it's butterfly shaped. So it's very prominent and visible to see. And it sits just in front of the trachea. The pathophysiology of Graves' disease. This disease occurs when the immune system stimulates the thyroid excessively, which leads to an overproduction of thyroid hormones. This happens because the body creates thyroid stimulating immunoglobulins, and the thyroid stimulating immunoglobulins attaches to the thyroid stimulating hormone receptors. This tricks the brain into making a lot of T3 and T4, which then causes hyperthyroidism. Here is the etiology. Graves' disease is a combination of genetic, immune, and environmental factors. People with the family history has a 15 to 20% increased risk of having this disease. And some associated genes with Graves' disease includes HLA-DR3, which is a human leukocyte antigen. There is also CTLA4 protein found on T cells, and PTPN22, which is a type of protein. Uh, Here we come along with the epidemiology. This is a research paper I found from Pacro and Busso's article called Graves' disease, and they stated that Graves' disease is the most common cause of hyperthyroidism, accounting for 60% to 80% of hyperthyroid cases. With this disease, you can find it more common in women than men, and their chances increase during periods of hormonal changes, especially in pregnancy and postpartum, and most common in the ages of 20 to 50 years old. Here we have the signs and symptoms of Graves' disease. Uh, in a patient, we can probably see swelling of the neck, weight loss, tremors, especially in the hands and fingers, tachycardia, fast heartbeat, eyes bulging out, and some cases skin changes. And at the right side of my photo here, we also have goiter, sweating, palpitations, and even skin lesions, and sometimes unexpected weight loss, like I just said, and some complications of Graves' disease. Here we have thyroid storm, which is an extreme overproduction of the thyroid hormone. It is triggered by an infection, trauma, surgery, or any uncontrolled hyperthyroidism. And some symptoms for thyroid storm includes vomiting, diarrhea, and fever. Graves' disease can also cause osteoporosis and bone loss. This is because an abundant amount of thyroid production speeds up bone turnover. And there is also dermopathy, which is any thickening or redness of the skin. Any of this can also be a concern for a patient. And there is also ophthalmopathy, which is an autoimmune inflammation of the eye muscles and tissues around the eye socket. For a diagnostic test of Graves' disease, healthcare professional may do a physical examination and ask for past medical health and family history. Here are the most common four diagnostic tests. We have the thyroid function test, which is a blood test to see if there are any high levels of T3 or T4 found inside the thyroid. There's also radioactive iodine uptake. This goes to see how much iodine the thyroid can absorb. There's also eye examination, where they use a CT scan or an MRI scan in the tissues behind the eye, and also the thyroid ultrasound. As you see here in this bottom right picture, is a it's an example of a thyroid ultrasound. And some medical treatments includes anti-thyroid drugs, any radioactive iodine treatment, subtotal or total thyroidectomy. Thyroidectomy is considered to be the most definitive treatment for Graves' disease, by the way. Here we have our prognosis. Overall, the prognosis of Graves' disease is generally good with proper treatment. Treatments can help patients achieve long-term controls of their symptoms. Radioactive iodine therapy and thyroidectomy provides control over hypothyroidism. So these two therapies are probably the most effective, and patients should avoid the use of smoking as it can cause detrimental effects on the thyroid. Lifestyle factors influence prognosis. Here we have some lifestyle modifications and patient education. Number one, stop smoking. Patient has to stop smoking. Smoking is detrimental towards the body. Take their medications, appropriate medications for Graves' disease. Be conscious of diet and nutrition. Uh, the patient should be encouraged to do any light to moderate exercises to help with mood and overall health. Avoid consuming high iodine foods such as seafood, dairy, eggs, seaweed. We as PTAs should provide patient education, following up with their daily checkups to see how they are doing, and also provide heart health monitoring and provide education on avoiding hot environments and dehydration for our patients with Graves' disease. The roles of the PTA. Some of the roles include monitoring vitals for a patient with Graves' disease closely before and after their exercises, especially their heart rate, blood pressure, oxygen saturation levels. Encourage stress reduction techniques, ensure safe mobility and balance, communicate with other therapists over any concerns with patient health, chest pain, any eye changes, severe fatigue, nausea, and also manage muscle weakness and fatigue. Here we have an example of a little case study. We have a patient that's 42-year-old female. Symptoms include tremors, weight loss, heat intolerance, eye irritation. Exams include mild exophthalmos, proximal weakness, also tachycardia being found. The lab results concluded that there is a decrease in TSH, increase in T4, the T3 and T4, and an increase in thyroid or positive in thyroid stimulating immunoglobulin. Uh, Here, with those lab results, we can conclude that the diagnosis is obviously Graves' disease. So, for treatment with Graves' disease, include methimazole, methimazole, propanol, and eye lubricants. The focus for the PT should be encouraging patient education with heat management, put in any endurance, especially strengthening exercises and building up endurance. And also, the prognosis should be to improve with further treatment. And that is it. Here is my works cited, and that's it.